Hi everybody, Mike Pizzana here with General Devices. I'm going to walk you through our GD eBridge workflow, specifically our trauma case. So we're going to put special attention onto our trauma case right here. This is what EMS's view is going to look like for this iPad here. So clicking on this trauma case, you see there's a lot of information in this. However, all of this is configurable and none of it is required. So EMS can simply just hit this notify button down here at the bottom of the screen, and that'll allow them to send the notification off. However, why don't we put in a little bit of information just to send to the hospital? So let's say some special considerations. We have loss of consciousness. We maybe know this person's over the age of 65 and on blood thinners. Working our way down, again, these are all configurable options. And we have this across the country we surveyed, and this is what we chose to put into this workflow case here. Let's just put in our blood pressure. Let's say that it is 80 systolic and we do have a GCS of, let's just say 8. So with all that information, we'll hit notify, confirm the notification. Now EMS is done. You can see that this message was sent off to the hospital. The hospital right now is receiving this audible and visual alert. We're going to click and open that case and see what the hospital sees. So now looking on the hospital view, we can see all the information that EMS put in, that there was a loss of consciousness. Patient is on blood thinners. They are 65 years of age or older, excuse me. And we have a systolic blood pressure of 80 with a GCS of 8. So what the hospital can do right now is they can acknowledge EMS. EMS is going to receive an audible and a visual alert onto their device, and they're able to view that. The beauty of all of this right now is everything is time-stamped. So kind of going back to the hospital view, reviewing all of this information, we can see on the EMS side that they're potentially putting in more information real time. So this is almost like a group chat and very collaborative. So we can say, let's just say they gave some pain management, the patient's boarded and collar, they have an IV in place, and with that GCS, they have a advanced airway as well. So again, I just mentioned there's a group chat function. I'm going to show you how that looks soon once we alert the trauma team. So simply clicking this button here at the bottom, we're going to alert the team, say yes. And what that's going to do is it's going to bring the rest of the trauma team in, giving that device an audible and a visual alert. So right now, that entire trauma team, whoever we have listed on that alert, can view and receive all of that. Everything is time-stamped, and there's a ticking time clock down here at the bottom, exactly when everything was sent and acknowledged. So kind of switching back over here to this group chat function, we can pull this up and we can send group chats back and forth. Patient arrested, let's just say, and we'll send that. So now everybody on that case is going to get an audible and a visual alert of that, specifically showing exactly what's in that group chat. So clicking on that, this is what the trauma team is seeing, that the patient arrested. If we're going back over to EMS's view, we can see that they're also receiving this as well, that the patient arrested and everyone's on the same group chat. So if the hospital or the trauma team, for example, wants to say, let's proceed directly to the OR, simply typing that in is going to keep everybody involved, and everybody's getting the same alert and the same group chat message within that. So you can see all of this is simply seamless altogether. There's the opportunity down here for the hospital to call EMS back, and that can do a video or an audio call. Also assigning a quick pod. If we're not going to go to the trauma bay for this patient, say we want to go to a regular room. And an audible and visual alerts given to everybody on that case. So if we scroll all the way down, we got that audible and visual alert. We're going to pod B, room assignment 25. All these buttons down here at the bottom of the screen are completely configurable. If you wanted the OR to have a different view, to say OR's ready, if you wanted to timestamp when your blood bank was notified, anything along those lines, it's all completely configurable with eBridge workflow and eBridge in general. Right now, we're just going to end the case here. And what that is doing is going to take it off of our dashboard. It's going to take it off of our live GPS tracking. It's also going to notify all the different stakeholders involved that the case has ended. As always, all this information is recorded in our DescribeX platform for different analytical purposes and for the monthly and annual reports. Thank you all for tuning in, learning about eBridge trauma workflow. I appreciate your time, and please reach out to me if you'd like to see some more demonstrations or learn a little bit more information about this. Take care.